Hello and welcome. I'm Dr. Ankit Parakh. I work as a consultant in pediatric pulmonology, allergy, and sleep medicine at Children's Chest Clinic, New Delhi. Now, as we all know, asthma is a chronic problem which we see at all ages. And asthma sometimes can be difficult to diagnose, more so in young children. So in this video, we'll talk about what are the clues which you can identify, which can lead you to suspect asthma in a young child who is less than 5 years of age. Now, the main symptoms of asthma are coughing, wheezing, breathlessness, and chest pain. Now, let's talk about these individual symptoms. Children get cough all the time. So how do you know that this cough is because of asthma? So usually, when a child gets a cough with a viral infection, it settles down in 5 to 7 days. If the cough doesn't settle down in this duration and continues for a longer duration, like 2 to 3 weeks or even longer, that might be an indicator that the child is having asthma. The cough of asthma predominantly occurs at night and at early mornings. In many children, they get cough after they exercise. Coughing after exercise is not something which is seen normally in children. So be watchful for these symptoms. The other symptoms which is commonly seen in children with asthma is wheezing. So wheezing is a whistling sound which is heard when a child is breathing out. So a sound something like this. Now this wheezing sound sometimes can be difficult to appreciate. Now, occasionally this wheezing sound can be heard if you are near to the child or if you are putting your ear on the child's chest. But many a times this cannot be diagnosed in this way, and you need a doctor to examine the child with the help of a stethoscope. So even if the child, you're not hearing a wheeze in your child still might be having a wheeze which you may not have identified and your doctor needs to examine. Now, breathlessness is the other symptom of asthma which you need to watch for, and this breathlessness is usually seen once the child does some exercise or plays around. It's normal for children to get a bit breathless after doing heavy exercise, but if they become breathless after doing an exercise which they used to do a few months back but they can't do it now, then that means that it is a problem. Also, you can compare your child with the peers that the other children are not getting breathless, but your child is. So these are indicators which can tell that this breathlessness is an indicator of asthma. Chest pain is not something which children would usually complain of because they're not as old, but they can say that they're not feeling good, they're feeling uneasy in the chest. Some children might complain of tummy pain as well. Now, in addition to these 4 main symptoms, children can also get asthma attacks where they start to cough, they start to wheeze, they become breathless in a very short time span, and in these durations they need to be treated urgently with some sort of bronchodilators, either in the form of nebulization or inhalers. And some children can get these frequent attacks. Now, these are the main clues which can help us to identify that a toddler is having asthma. In addition, if a child is having other allergies, such as nasal allergies, such as eye allergies, an atopic skin or atopic dermatitis, or having food allergies, the chances of having asthma are higher. A proper diagnosis can lead to an appropriate treatment which can settle down the cough, wheezing, or breathlessness quickly so that our children are able to enjoy their life. So, if your child is having any such symptoms suggestive of asthma, do get in touch with a pediatric pulmonologist or allergist for a valuable opinion and further guidance. Thank you very much.